so just and faithful a manner as to promote your honor and glory and to advance the peace, prosperity, and welfare of our country and of those whose interests you have committed to our charges. Amen. Thank you, members. I am sorry we are late by almost 30 minutes, almost 40 minutes. We were supposed to have started our vetting at 8:30, but because of housekeeping, we are starting at 9:15. And before we proceed, I want to introduce myself. My name is Rebecca Magut Chepchirchir, representing UGCAPBU Ward, a member of this committee and the chair of Health Committee in the Assembly.
My name is Honorable Isaac Kirwa Kemboy, MCA Kapsoya, Vice Chair in this committee. Thank you.
Thank you.
Thank you, Chair, members. The nominee, my name is Julia Sang. I represent Megun Ward, a member of this committee.
Thank you, Chair. My name is Hilary Kipchumba, MCA Moibien Ward, and a member of this committee.
My name is Moses Kebenei, MCA Simat Kapsaret, and also a member to the committee.
Good morning. My name is Malamoch Nathan Maina, MCA Segiro Barsombe Ward, a member to this committee.
Good morning. My name is Gilbert Kiptoche Pkonga, member representing Ainapko Olare Ward, a friend to this committee.
My name is Cherono Caroline, MCA nominated, member of this committee.
And my name is Honorable CPA Samuel Sawe, member representing Kamagut and member of this committee.
Good morning, everyone. My name is Kapkea Evans, member for Tembelia Ward and member to this committee.
Proceed, Lynette.
Good morning. My name is Lynette Angela Chepkoech, Hansard Officer to the Health Committee.
Good morning. My name is Miriam Sawe, HR.
Sharon Kwamba, Sajinata.
Thomas Albe, Sajinata.
I'm Vivian Rongoy, I clerk this committee.
Thank you, members, for that introduction. I want our candidate of Health Department to introduce himself. Welcome.
Thank you very much, Honorable Chair. Thank you for this opportunity to be here today to prove my suitability. My name is Paul Wangwe Ongeti, a dentist by profession, 34-year-old Christian Kenyan by birth. I was born in Uasin Gishu County, Rescos Ward, Keses Sub-County, in 1988, 9th November. I grew up in this town, went to school at Testimony Primary School, where I did my primary certificate in the year 2002. I further progressed to Alliance High School, where I did my KCSE certificate, finished in the year 2006. Then, after that, I did a diploma in French in 2007. Then proceeded and did dental surgery, Bachelor's of Dental Surgery, at the College of Health Sciences, Moi University, where I finished in 2013, graduated. So, Paul Wangwe Ongeti is enthusiastic about healthcare and service delivery of healthcare. Since my graduation, I have done an internship at Moi Teaching and Referral Hospital in the year 2014-2015, because it started mid-2014 to mid-2015. Then I was given a job at Kakamega County, where I was head of department, Matungu Sub-County Hospital, for a year, dental services, and again was transferred to Malava Sub-County Hospital, where I headed the dental department. Then I left public service and went to the private sector, where I grew a company. I was director of a company called Aquadent Company Limited. That is where I have been the director. I was the director at the same time I was working at Kakamega County, but I decided to stop and focus on private practice. So I did private practice for a few years up to this point, where I now am applied to be Chief Officer of Wasingishu County, Chief Officer of Health, so that I go back and serve the public in an administrative position and in a different way. Yes. Thank you, Honorable Chair.
Thank you so much for that elaborated introductory. Members, this morning we are here according to the standing orders that guides the assemblies, pursuant to the provision of Section 45 of the County Government Act 2012, Section 5 of the Public Appointment County Assembly Approval Act of 2017, and Standing Order number 51 of the County Assembly. The Standing Order number 51 is upon the receipt of notification of nomination for the appointment of this office under the Constitution or order or under any other legislation required to be approved by the County Assembly, the nominations of the appointee is supposed to come to this House according to the standing order. And we are asking our nominee that we are working according to the standing order that guides the assemblies as a legislative house. The County Government Act also, Section 8, states that the County Assembly shall vet and approve nominees for appointment to public offices as may be provided for in this act or any other law. So we are here according to the law, which I've just quoted. And I would like to know if Mr. Wangwe, you saw an advert of the same job said today.
Yes, I saw an advert on the county government online platform in November 2022.
Okay.
Yes.
You applied for which position? Because there were two positions.
I applied for Chief Officer, Clinical Services, Wasingishu County.
Okay, thank you. Members, you attest to that there was an advert? Okay. Again, on the same, I'd like to know from the nominee if you saw again an advert from the county government asking you to come to this office and also to the public to know that this day we are going to vet you.
Yes, Honorable Chair, I did see an announcement giving the dates.
Giving the dates.
Yes.
Okay. Now, members, our nominee has introduced himself. We have quoted the necessary acts that leads us to what we are doing this morning. And then let me just go straight to our question number 2. What, Mr. Wangwe, what motivated you to want to be a CEO in Uasin Gishu County? And how will your skills, individual skills and experience, contribute to improve the service delivery in Uasin Gishu County? You know, health care is universal. You know, health care is key to any county. If we are health, that means other things will just follow. Number 2, my question is, what are your statutes? What are the statutes that give you jurisdiction to this devolution? Because you know the health services were devolved. Yes. What do you know about the devolution on health services? What were devolved? Because there are some functions still with the national government, and there are functions which were purely devolved to the county government. Let me ask you the third one, and then you answer those. Then I give the honorable members to proceed. Another question I would like to know, as part of the opening remarks, is what would you do in circumstances where you are not supported in the demonstrating commitment to the highest ethical standards? How do you reconcile being asked to pursue a policy position that might not reflect your personal values? Thank you. You can answer those 3 questions, and then we proceed. I give members to ask more questions. Thank you.
Thank you very much, Honorable Chair. To start with the first question, I applied for Chief Officer because I am enthusiastic in service to the community. The reason why I specifically chose Chief Officer is because I believe I am a people's person. I am a good administrator because I've been able to grow a private practice from 0 to be able to serve more than 500 patients a month. So me being focused, diligent, I believe I can transfer the same skills, the same enthusiasm, the same expertise to the county and serve the wider public. Then another motivation is I believe I'm tech savvy. I think we are in an era where we are supposed to digitize things for, sorry?
Yes,
please.
You know, we did introduction. Yes, we didn't see your identity card. Maybe we are vetting somebody we don't. You have gotten, okay, yes. Fine. Thank you, thank you.
Yes, I have given it, yeah. So I believe I'm a good administrator because I've had some experience in administration in public, in Kakamega County, in the dental department, and also in my private practice and private businesses, where I manage a staff of 15 employees. Then the statutes that I would regard are integrity. Those are mostly the things that's mostly what will govern me in execution of my duties. Another thing that I would observe is following proper procedures and following the law. Then the functions that have been devolved, we have the national government, which retained 35 functions, and the county governments took 14 functions. Some of these functions in healthcare are concurrent functions. We have primary healthcare, malaria control, TB, ambulatory services, cemetery, food and hygiene. Those are some of the alcohol regulation, and yes, those are some of the functions that have been, health functions that have been devolved. We have other functions that are concurrent with the national government. For example, the disaster management. That is an example of a concurrent function. So I am aware of these functions. In the case where I have the third question, if I may ask you to repeat, Honorable Chair. Yes.
We'll repeat. The third question was, what would you do in circumstances where you are not supported in demonstrating? I hope you understand what I'm saying.
Yes.
Like if the governor will interfere with what you think it is right and what you think it's supposed to be done, or any other person, even the CEC, even your staff, how will you demonstrate the commitment to the highest ethical standards? Because I believe that ethical, that you want to give us that services, how will you handle? How do you reconcile being asked to pursue a policy position that might not reflect your personal values? You know, this is, remember, this is also a political office.
Yes.
Sometimes I can come there as an MCA and demand that my people did not get medication or there are no medicine in my place. How will you demonstrate yourself?
Okay. Thank you very much for repetition, Honorable Chair. I have many reasons why I would stick to my principles. First of all, I took a Hippocratic oath as a doctor, which stipulates that a doctor should have high ethical standards in practice, whether in curative practice, in administrative practice, and in any other manner. Secondly, I have been brought up in a very strict background, where I have been brought up to be honest and to say the truth. So this is how I will deal with it. I will consult widely, consult my area MCA, Member of Parliament, I will consult my peers, I will consult with the law, and advise. The second thing I would do is advise the person in question about what the law stipulates.
Exactly, you have just answered.
Yes.
The best word is to advise.
Yes.
You are there to give professional advice to the department.
Yeah.
Thank you.
Thank you.
Members, let me open the floor for members to ask more questions to our nominee. Yes, Kapseret, Honorable Member, Mr. Kebene.
Okay. Daktari Wangwe, karibu.
Asante.
Welcome. Now, you said you saw an advert dated November, the year November 2022. There were two positions. You applied for the position that you're here today. I just wanted to know how many, after the filtering, how many were you interviewed? If you may know, and by any chance, were you given results of the interview? And where was the interview done?
According to the shortlisting, we were 9 candidates. The interview was done at the Kapseret sub-county headquarters. The results I got showing that I am a nominee. I did not get any interim results after the interview. The next was the nomination, the notice of nomination. Yes.
Okay, maybe through the chair, you got the results, your only results for all the candidates. The results that were given. Were you given the results as per all the shortlisted candidates, or you were just given an individual results that you got a certain percentage or something like that?
Honorable MCA Kebene, I was not given, I did not follow up to get my actual marks or results.
Thank you, Chair. My name is Aaron Sitianei, Director Information Services.
And also